So, should we make a start? Hello, everyone. My name is Dr. Duncan Gilbert. I'm a clinical oncologist in Sussex in the UK and senior lecturer in cancer and clinical trials at the MRC CTU. I'm delighted to be joined today for today's webinar on how to be a good principal investigator, brought to you by the MRC Clinical Trials Unit at UCL and the Global Health Network. I'm delighted to be joined today by Dr. Julia Bielicki, consultant in paediatric infectious diseases and lead physician infection prevention and control at University of Basel. Dr. Cissy Kityo, executive director of the Joint Clinical Research Centre in Uganda. Professor Hilda Mujuru, professor of paediatrics and child health and lecturer at the University of Zimbabwe. And Professor Andrew Prendergast, a professor in paediatric infection and immunology at Queen Mary University of London. So this panel of 4 experienced PIs from Africa, Europe and the UK, together we'll be sharing insights, personal experience and tips in an interactive discussion, and key there being interactive, where you've got an opportunity to ask questions and engage with the speakers. The webinar is aimed at early or mid-career researchers who have some experience of being a study or site PI and wish to enhance their skills. And please join us for what should be a really interesting webinar. Just in terms of a little bit of housekeeping before we begin. So the session's being recorded, and the recording will be shared in the coming days on the Global Health Network platform, so you can review materials and share. These can be found using the link that's just been shared in the chat box. To interact with us all, please use the Q&A chat function, which you can find in your toolbar. Any technical issues, please let us know in the chat, and the Global Health Network team will aim to assist you. If you'd like to ask a question verbally, please raise your hand during the Q&A, and I'll do my best to link you in, but try and use the Q&A box if possible. We've plenty of dedicated time allocated for questions and answers, so we'll try and get through as many as possible. But if we don't have time for all of your questions, we'll save them and try and share written responses along with the recording. So without further ado, we'll begin the programme for today. And firstly, I'd like to welcome Dr. Julia Bielicki. Julia works as a consultant in paediatric infectious diseases and infection prevention at the University of Basel Children's Hospital, and a reader with the Paediatric Infectious Diseases Research Group at St George's, University of London. So Julia, over to you.
So thank you. So I've got a few slides to share, but they're really just for illustrative purposes. Let me know if you have any issues with seeing them. Right. So we were sort of given a little bit of a brief of what maybe to focus on for a few minutes, where each of us will be speaking to you. And the first thing to highlight is maybe what exactly our personal experience of being a PI is. I've been a PI and also a coordinator of various studies and trials, but I've picked one here from the University Children's Hospital in Basel that is currently ongoing, called KidStep. It's a trial in infection where we are wanting to investigate if steroids positively affect the illness course of children admitted with pneumonia to hospital. So this is a trial that I'm leading both as a chief investigator, but also locally in Basel for site issues. You can see here the different sites that are participating in the trial. Let me just put on my laser pointer here. Basel, this is us. So the green is the recruited patients, the blue is the patients that we would like to recruit. So you can see we have a little way to go yet. This is a straightforward randomized control trial enrolling children with pneumonia admitted to hospital, very pragmatic. It's a placebo-controlled trial, so it's really a very classical example of an RCT, I would say. And I mean, I came to this trial having had some experience working with PIs in prior trials, as many people do. And I haven't brought much text to share what my experience of working with PIs has been with you, but I've brought a picture. And this is a picture of a breakfast machine. So you can see the breakfast table here, and you can see all the kind of different elements that go into making this breakfast. Of course, unfortunately, such a machine doesn't exist. But to me, working with PIs, who I've considered good or helpful, or who've facilitated me making a meaningful contribution to trials, has been really that we end up at this point with breakfast on the table, so the result of the trial, and mine having a sense that they are really managing all of the different elements that are happening behind the scenes. Obviously, you can also turn this sort of into a negative example. Luckily, I actually haven't experienced this, but I know of colleagues who've worked with PIs where it's been very obvious that there's been some element in the complex structuring of a trial that hasn't been maybe appropriately managed by the PI that they were working with, either locally on site or for coordinating the trial as a whole. In terms of what I think the challenges of being a good PI are, and I mean, I can use KitStep that I've presented to you as an example. I think it's a bit like herding cats. So it is really this issue of understanding exactly where your intervention or support is needed, but also where maybe it's best not to interfere. Thinking back to my breakfast machine, so which elements of the machine you need to be tweaking or addressing to make sure that all the different elements can interact in such a way as to give a successful trial at the end. And that is something that can be quite challenging, and at least to me isn't always obvious. So I spend quite a lot of time thinking about exactly what it is that I need to be doing for each of the trials where I'm involved as a PI, or where I'm working with a PI, to make sure that the trial can be a success. I also have a top tip, but I understand we're going to come back to this later on, Duncan, so I'm going to stop sharing here. And yeah, if anyone has any specific questions, obviously I'll be happy to answer them, and I look forward to the discussion.
Julia, thank you, and yes, we'll look forward to hearing the top tip. Thank you for a great start, and some really setting the scene, and some inspiring slides as well. So next, Dr. Cissy Kityo is among the pioneers of scientists who scaled up antiretroviral in Uganda and sub-Saharan Africa since 1992. As a member of the AIDS task force and previously chair for the AIDS clinical care subcommittee, she was involved in planning and writing the first strategic plan for a national program to increase access to care and ARVs. Clearly, she has extensive experience in delivering and coordinating research. And Cissy, over to you.
Thank you, Duncan. Luis, can you put up my slides, please? And thanks for everyone who is attending this session. Yes, so they've already introduced me, and I've been a PI for over 25 years, I think close to 30. So I've been a PI for individual research projects, but I've also been a site PI for a group of projects like the AIDS clinical trials group. So these are the many responsibilities of a principal investigator, and the detail you can read from the International Conference on Harmonization Good Clinical Practice, Section 4. So when you look at everything, I think some people with weak hearts can start to say, no, I'll not be a PI, and I cannot manage this. How do I do all this? The beauty of clinical trials and of being a PI is that you delegate each of those tasks to people whom you think are capable of doing the work. And on the left side is a sample of a delegation log where I have delegated different responsibilities to different people. So the work is teamwork, and you as the PI is the supervisor overall. So this delegation log is very important. The monitor or the sponsor will come and check that it is done, that it's done properly, that it is dated properly. However, this delegation log and your delegation and signature on this piece of paper is not what does the work. It's not what makes you a good principal investigator. It's not what makes a clinical trial be implemented successfully. And from my experience, I'm going to share with you what I've done with regards to effective delegation beyond this piece of paper, which is in your investigator site file, monitored every so many months. I've found that effective delegation is the quickest way to perform excellently. And effective delegation can come in many forms, and I will talk about it in the next slide. But it is really proactive and intentional actions from you as a principal investigator that makes the work get done. And for me, I've done this for a long time, so it is a skill that I have had to acquire. Maybe my PI in the earlier studies wasn't as good as today. And then this delegation or effective delegation developed over time through experience. But it has also demanded that I have confidence in myself and I also have leadership. Otherwise, if you don't have those two, then you cannot delegate and supervise others. I've also seen that delegation rewards everyone. I get time to do more strategic work if I've delegated to others, and the people that I delegate to get to develop their skills and also to grow in their jobs. And this is part of the process where I mentor the next PIs so that I can do other work again. So some of the intentional things that you have to do is to build the team and relationship between the team. And I always tell my people for different projects, we work as a team, but if one person does not do their duties, we fail all of us as a team. So it is our responsibility as a team to work together. Delegation does not mean you go away and have a holiday. You have to check often to know how delegated tasks are going, i.e. you have to be proactive after delegating. It's like a daily thing, the proactiveness. You have to have routine communication. It is quite essential. And communication can come in many ways, maybe very regular meetings at certain points of the study. But also now there is email. There is email every day from the sponsor, from the funder, from the CRO. And you think that they've copied your team, you have to know what they've copied them, and you have to make sure that those things are done. So routine communication is very important. Also, sometimes people may fear to come back to you as the PI. So when you communicate and reach out and see how they are doing, you're able to help them. You have to set goals, of course, and you have to focus on the outcomes. All of you as a team, but in you as a PI and the individual people you have delegated to. And don't focus so much on the process, although you have to have quality results, look at the outcomes. And I've also seen that praising good work really motivates people. Don't take things for granted. Public recognition inspires loyalty and increases motivation in your team and enhances the team building as well. So one of the biggest challenges is that because I've been a principal investigator, I've implemented projects successfully. I'm sought after by everyone. I cannot do all the work. And so sometimes this can get overwhelming because some people will insist, if you're not the PI, then we don't give you the project. So it is very important to train the many people who are on this call today to become the next PIs of tomorrow. And then, although it's not written in the ICH guidelines, a PI is responsible for keeping track of your trial budget. We leave it to the finance people, and sometimes we may get into problems. So you need to track the outcome of your budget or the performance of your budget. And because it is the lifeline of your work. And with the few minutes I was given, this is what I had to share for now. Thank you.
Fantastic, Cissy. Thank you. And yeah, lots of things there I wish I knew, but when I started. So moving on, we've got Professor Hilda Mujuru, Professor of Paediatrics and Child Health, lecturer at the University of Zimbabwe. Professor Mujuru is Professor of Paediatrics and Child Health, working mostly on infectious diseases, research interests in HIV and AIDS in children, malaria, epidemiology, pulmonology, integrated management of childhood disease and medical education. She's worked with WHO and CDC on infectious disease research, including the impact and introduction of rotavirus and pneumococcus conjugate vaccines in Zimbabwe. So Hilda, over to you.
Thank you very much, and good morning to everyone. I'm just going to share a few slides, and this is like the outline of what we're going to discuss. These put here are the roles of a PI, and most of these have been covered. But I thought that we move from being a PI to being a good PI. So what I'm going to touch on are how you can try and make yourself not just a PI, but a good PI. I'm going to share with you personal and observed experiences. And this, for you to be a good PI, you need a combination of skills and behaviors. And that will help you to build a robust team, a team that you have confidence in, and a team that has confidence in you. It is very, very important that you both have confidence in each other and you have trust in your team. There's need for diversity in your team, and that actually makes the team stronger. I found that it is important to lead from the front. You should lead by example. You must be a hands-on person. You have the ability to delegate, and you must delegate. I think Cissy has touched on that, but it is also very important for you to also lead by example. You should be creative. Think about new ideas, and you should be receptive to new ideas from your team members and be open to implementing even what's the lowest team member throws on the table as a good idea. Your aim is to grow your team. You need a replacement. So you are a PI, but you can only be as good as the people that you train to take over from you. So you need to develop and make sure that you give them writing skills. You need to develop and make sure that not only mentees have got the writing skills, but even just team members, that's how you grow them. And this is writing papers, this is writing for grants. It is very important for a good PI to pass such skills to their mentees. And every time you must aim for benefit for time. Whatever you do as a PI, if you're a good PI, you must at the end count your output. How did I use my time? What did I get out of the time that I invested? And as usual, we work as a team, and it's important to complement co-investigators and your team members and not be obstructive. We need to know our team. Teams are made of different people. So you need to know your team as a group. How do they work together? How well do they manage as a team? But it's also good to individualize. And hey, people you work with like personalized interactions. If you're walking down the corridor, you meet Leonard, the driver. Say good morning, Leonard, by name. They feel good. They don't want to just say good morning and they think the boss is passing. No, show them that we are colleagues. So mention them by name. How are you today, Grace? So that Grace knows that I bring her tea, but she knows me and she recognizes my position. This needs to be mutual respect. You need to identify and know the strength of your team members and obviously work on weaknesses of some of the members. I think good PIs have got good ears. They listen. Take time to listen to your team members. And when you listen, you tend to hear. And when you don't listen, they say a lot of things, but you don't hear them. Be accessible and be approachable. So people talk about an open door policy. Allow your team members to be able to find time to interact with you. If they have a problem, I know there's hierarchy in most of the organizations that we work in. When you have a problem, you have to go to the head of division or head of department, and the head of department has to translate your problem to the next person until it reaches you as a PI. But there are times that I have confidential things that I want to talk to you as a PI, and it should be an open policy that your team members should be able to come to you for such things and be able to talk to you. Make the environment such that it is easy for team members to be able to come and talk to you and be able to communicate with them at the level that each of them understands. I think it's a good thing as a PI, if you're a good PI, to hold regular meetings, and the regular meetings should be for management. You have head of division or head of department meetings, but it's also good at our site, we hold what we call family meetings. Family meetings are a little different. They're not like the bosses are meeting and making decisions for us. Family meeting is where all members are invited, and even the lowest member can express themselves without having to go through some protocol and some hierarchy. And it's nice to hold those once or twice in a year, and it allows members of the team to feel that they belong. And I think as a good PI, it's very, very important for you to do that. You need to have tentacles in all departments. You can't know it all, but yes, you have to go into the clinic, know what's happening in the clinic, assist in a patient that is difficult in the clinic. You need to know what's happening in the lab. When the lab scientist says to you, we are using a Fisher's machine or we are using an Abbott for this test, it shouldn't be, what is that? Where is it coming from? But if you pop into the lab, have time with the lab manager, talk and know what's happening there. The data guys, and they say we are using, for this trial, we're using Open Clinic, we're using Medidata, we're using this. You need to know what those are and be conversant with them. You don't need to know the details, but you need to have at least an idea. So have your tentacles everywhere. Know what pharmacy is doing. Know what trial management is doing. And like Cissy said, you need to even know what the finance guys are doing. You need to spend time with the finance guys because we are the PI. And if you're a good PI, you need to know what's happening to the monies. How are we spending them? Where is the problem? Where can we put a few holes to stop this unnecessary spending and be able to live within our budget? So basically, as a PI, you need to know enough about every department. You don't need detailed information, but enough about every department. But having said that, you have a good team, you've put together, you have listened, but always look out and recognize burnout. Burnout will affect productivity. So you need to prevent burnout if you can, but if you fail to prevent it, please do recognize it and act on it. Remember that most of our members of the team have to trade off between demands of the research that you're carrying on, which is usually very, very demanding. They work over weekends. We are enrolling in this trial and we have to be there on a Saturday because the patient was enrolled on a Friday, but they've got a family and they need to take care of their family. Take time to also know about their family if you can. How is your child? How is your family doing? They feel they belong. And then they've got clinical duties. They have to run to the ward to do their other things. So they get burnout, and it's important to recognize it and do something about it. So teams need debriefing and team building sessions. And I think as a PI, it is your responsibility to be able to work on that, make sure you prevent burnout, but also if you haven't prevented it, then plan for a debriefing session or a team building session. Challenges, there are a few challenges that I've noticed as being a PI. One of them is just trying to keep your team as a cohesive team. We are one family, but as usual, when there are many of you, sometimes there tends to be groups, and within the groups, this group and that sort of thing. So that is a challenge. But most of the time when you work together, you try and say, look, we are one family, and you try and bring the team together. How do we keep these teams motivated? They've gone through all the GCP, they've read all those, whatever is required of them, but that is not all that keeps a team motivated. So you really need to look outside the usual things to say, how do I keep my team motivated? Sometimes it's not about their salary. Sometimes it's about opportunities that you give to them. Sometimes it's about, like I said, teaching them skills that they didn't have, but it's not easy. So sometimes we have found it a bit of a challenge to be able to find what exactly would motivate this team, try to get them to write for a grant. Maybe that's not what they want. They want to do a PhD, trying to get the topic. So all that can be a challenge sometimes. And then how do you maintain high levels of commitment? It is a challenge sometimes. People come to work very early, sometimes they finish late, but obviously they get to a time where they really feel they're done. How do you keep that motivation? How do you keep that commitment going? And sometimes we expect a lot from our teams. We expect them to go beyond the call of duty, but then that becomes a challenge sometimes. I was told that the top tip would come later, so I'll move and we'll come back to that. These are some of the things that I read, which I found also to add on to sort of the experience that I've had, how to be a good principal investigator. And the 10 simple rules, I found them interesting because they really spoke to the things that I have experienced. Thank you very much.
Hilda, thank you. Lots to inspire all of us there. And yes, we'll come back to the top tips, and looking forward to lots of questions from all of you as well. But one final presentation from Professor Prendergast. So Andrew's Professor of Paediatric Infection and Immunology at Queen Mary University of London, having graduated from Cambridge and Imperial College. And after paediatric training in London, he specialised in paediatric infectious diseases and immunology. First as an academic clinical lecturer in the Department of Paediatrics in Oxford, researching paediatric HIV and work on HIV clinical trials, and subsequently through a Wellcome Trust fellowship was appointed as senior lecturer in paediatric infection immunity at Queen Mary University of London, and then a Wellcome Trust senior clinical fellowship, and now divides his time between London, based at the Blizzard Institute in Zimbabwe. So Andrew, over to you.
Great, thank you, Duncan. And the great news is that we all prepared our presentations independently, but I think a lot of what I'm going to say has been said already. So that's good news. I might give a little perspective perhaps on if you're a PI who's also setting up a trial, and think about some of the considerations at that stage as well. So I think you've heard my background, but I work in global child health research, principally doing pragmatic trials in sub-Saharan Africa. Some are drug trials, some are non-drug trials. Usually we embed laboratory sub-studies into them to understand mechanisms of disease. And my own sort of focus is really on healthy birth, growth, and development in children, and particularly in areas with a high prevalence of HIV still. So predominantly these have been multi-center trials across Africa. And so again, what makes it a good PI? I think Hilda said this better than me with the tentacles that are going into every department, but I think it's exactly what she said, that there's a funny balance as a PI between the big picture and really getting into the weeds. And the reason is, as Cissy showed on the delegation log, you're ultimately responsible for everything. And so you need to have those tentacles that understand enough about each department to be able to be accountable for what's happening. But occasionally you do just have to get into the weeds, and it might be an area that's outside your particular expertise, but you know there's a block, and that if you don't help resolve this lab assay or this financial issue or this social science methodology, the trial's going to get stuck in some way. So it's really sort of getting that tightrope walk correct, that you have enough big picture, you don't get drawn into every rabbit hole, but you can hold meetings with individual departments if needed. I think a lot of this comes down to setting up good systems. And of course, GCP is all about documentation and systems and standardizing things. So if you use sort of standard tools, from everything from training through to delegation of duties through to reporting, that will help and is the kind of thing that monitors are looking for. If you don't have those available, you might want to set up standardized systems, documents, templates, SOPs. That's really the sort of bedrock of GCP. I agree with others who said regular meetings are important. And, we find across different trials, we have a standard agenda for all of them, with each department knowing they're going to report on their weekly progress, whether it's pharmacy, lab, data, whatever. And having that standard agenda, everyone is accountable, everyone knows the topics that are going to come up. We try hard to keep them to an hour and no more than that. And I think, sometimes people question how frequently you need to meet. I found weekly is good for active trials, because it's amazing how often issues have gone unreported during the week and they come up on that call and you're able to then kind of tackle them. Again, as Hilda says, completely agree, getting a good team and then getting to know them, celebrating those successes so you can keep people motivated to the end. I think, like writing a paper, the last 5% is the hardest part, right? So that very last bit of enrollment or follow-up, people sometimes take their eye off the ball. There's sometimes that inevitable downscaling of your team that's going to happen that can be quite tricky. And how do you keep that motivation right to the end? So we tend to celebrate landmarks in small ways, a celebratory cake, a lunch, or something to kind of keep people feeling motivated and that their good work is recognized. So I'm going to talk about some of the challenges from the perspective of perhaps you put in a grant, you want to do a trial, and I think almost universally grants are overambitious, and we all do that because we want to answer lots of questions in one trial, or we think our grant won't get funded if it hasn't got everything in it. But I think where the detail comes in is when you now move from a grant that you got funded to writing the protocol, to then the really critical step of writing the day-to-day procedures. And that's often where you see whether you've been overambitious, that if you expect one team member to be doing 20 different tasks each day, as you begin to list them out in your manual of operations, you might have overreached. And so, but being sensible about sort of being efficient with the way you answer questions in a grant, but not too overambitious for the team who's ultimately on the ground having to do this from day to day. And it's not us as the PI who's in the weeds doing this. It's your research nurse who's in the clinic and you're expecting her to see 20 participants in a day. That's where you need to be realistic. I have this rule of twos, which is an exaggeration, but makes the point that I find things always take 2 times as long as you expect. The costs are always double what you think, and the event rates in a trial are always 2 times lower than you expect. So in terms of timing, I kind of religiously Gantt chart everything and build in realistic timelines. Like, don't try and promise the world. If it really does take 9 months to get every last bit of ethics and regulatory approval, put it on a Gantt chart and tell the rest of the team that's how long it takes. Costs hopefully are not twice as high as you think, but often costs rise. You need to have a buffer. You need to budget realistically. And we often find, we're looking for other sources of money to co-fund activities. And I think just be reassured that's often very normal in many places that, again, funders have a cap on their budgets. You may not have accounted for everything that it takes. So I think budgeting is really important. And then event rates being lower is sort of well regarded in trials. It's recognized that, when you work to first design your trial, be really realistic. Like, are you really going to see that reduction in outcomes that you expect with your intervention? Is your event rate in the control arm really going to be as high as you think? Maybe you need to budget for a higher sample size. And then there's a few practical things that particularly those of us who are doing trials in low middle income countries, you can't get most of the things you need necessarily in the country. So procurement is really complicated. It takes time. People who purely do trials in one country don't often recognize that. And it can take months to get a shipment of things, procured, consolidated, cleared, shipped into the country. So things like that, I think, need really factor into your costs and your time that I put above. And then in terms of budgets, what I do is every Friday have a budget meeting. It is my least favorite, but most important meeting of the week. And, you know, things change from week to week around budgets, things you didn't anticipate having to budget for. So I find being really on top of it weekly is really essential. And then my top tips, which I'm going to share now, because otherwise I'll forget them. So the first one is to simplify things so that when you're perhaps putting together a protocol or thinking about how are we going to keep all of these things running, just remember you've got to focus like a laser on the key things. You've got to enroll your full cohort and try and keep to your targets. You've got to get really good primary, secondary outcome data. So, you know, there's always competing demands. If something's got to drop to allow you to do that, maybe it is that 6th biological specimen somebody wants you to collect, or that piece of health economics data that, you know, is taking up half your research nurse's time. Sometimes you've got to really think, like, how do I simplify this? And I would say enrollment and outcome data are the key things you want to do super well. And then I think as you set up a trial, really good formative work is critical. More and more, many of us are trying to co-design interventions with the people affected by the conditions we're studying. So kind of really understanding their world. So actually really good formative work before you design your intervention is really important. I think there's no substitute for being on the ground. Whenever I go to our sites, I kind of look through participant binders, I kind of look through registers. I mean, literally being there on the ground is where you spot things, where you can praise good work, where you can identify problems. I think as a PI, yes, you're responsible for everything. You need that great team that everyone's talked about. But I think one really key thing is having a really good lieutenant or a kind of sidekick, whatever you want to call them, somebody who's really invested in this trial the way that you are, who's there, who's able to really spend more time than you can as the PI digging into some of the details. So, but they also understand every aspect of the trial. I think having that sort of second in command kind of person, I found to be a lifesaver in many trials, because it kind of allows you to spread the burden to somebody else who doesn't just understand lab or data, they understand all of it. And then finally, my sort of principle is you need to think like a monitor, think like a statistician, think like a participant. So as you think about think like a monitor, what are the things that a monitor is going to look for when they come to your site? So, you know, read a previous monitoring report and see the kind of things they care about. And it's remarkable the breadth of things that a monitor will look at. So you really need to think, is my site set up the way that a monitor will be happy? Thinking like a statistician is ultimately those are the people who are going to analyze your data and tell you whether this intervention worked or didn't work. If you're not collecting your data in the right way, you're going to be, you know, have problems at the end of the trial. So involve your data people early, collect data in the right way. Cognitive interviewing is something we haven't talked about, but it's part of formative work, making sure your question is asking what you think it's asking so that you actually collect really good data that the stats team will be happy with. And thinking like a participant is when we tend to layer in more and more and more things into a trial, and just think about what it's like for that participant who perhaps has to travel an hour to get to clinic, sit in the hot sun, have, you know, 5 different stations she goes around to kind of get all the data your different investigators want. Are we asking too much? So think about participant burden, and what's it like being a participant. You want them to have a really good experience and to think positively about this trial and encourage others to join. So how do you think like a participant as well as all these other roles? So thanks, I'll stop there.
Andrew, fantastic. Thank you very much. So 4 great presentations, and we want to get on to some of your questions. I'm not sure whether there was a top tip summary slide, but what I took from all of those, I mean, firstly, I would say being a good PI, you need to be passionate about the study that you're engaged with. You know, you have to fundamentally believe in that study. You need to be doing the research that you want, but clearly that isn't enough. And the thing that came out to me loud and clear from all of those presentations is how being a PI is a leadership role. You've got to lead your team. So all those important aspects of teamwork. but particularly I think, as Hilda particularly stressed, around listening and good listening. And also I liked Cissy's phrase about proactive delegation. Just because you're passionate about a study, think it's the right thing to be offering your patients, it's not going to delegate itself. You've got to do that proactively. And those management tips from Andrew at the end are also really important. So shall I ask the panel to put their videos back on? And if we just look through some of the questions as they've come in. So just to go back to the point I was just making. So Cissy and Hilda talked about the importance of good people management and team leadership. And what have you found most helpful in developing those skills beyond the extensive experience that you have? So is it formal training? Is it just experience? Is it learning through others?
Yeah, I can come in and Hilda can add. The training is important, but the training doesn't make you what you do in the clinic. I think, first of all, there has to be passion. Like you mentioned, people have to be passionate about the research. And they also need to have some people have inherent leadership skills and you don't need to build them. And self-confidence. And then being a good PI or building people is experiential, and you need to intentionally and proactively work with people to develop them. And people have skills, sometimes they even don't know about them. So you have to spot the skills and you help them develop them, but working alongside you. And you can have sessions one-on-one where you talk about issues that went well, issues that didn't go well, but becoming a good PI will not be taught in school on a blackboard. You have to be there to be part of the works and to be developed with a senior person. Hilda?
Thank you, Cissy. I think you said it all. Really, I agree that training plays a small part, but I think it's about you as a mentor and those finer things that you do that are not written in a curriculum, the so-called silent curriculum, where if you come to work at 9, your team members will be there at 9:15. If you come to work at 8, your team members will be there at 7:45. So it's that sort of little bits and pieces that you do to build your team, identify talent and build that talent. So I agree with Cissy that really it's about hands-on and you're being there more than training, but training is important. Thank you.
I would also add as well, in terms of mentorship, that have a voice. So as a PI, have a voice upwards to the sort of central trial team and the chief investigator and things. You know, you can get a lot of mentorship there, and as a chief investigator, it can feel quite lonely often. You know, reaching out to all the different PIs. The more feedback the central team gets, the better. And I think that interaction really helps build experience and confidence, especially as you're setting out.
Duncan,
So
can I just
Julia,
add to that? Because I think that the interesting thing is, if you're earlier on in your career, so one of the things I found most helpful is actually to find a PI to work with who's inspiring. And interestingly, sometimes that's not related to the exact question of the trial. I mean, you have to be passionate about that too, but it is often quite, well, for me, it's been possible to identify people that I thought, well, when I grow up, I would like to be like them. I mean, I still have these people around me, even though I am grown up now. And I think really trying hard as much as you can to identify these people and work with them so that you can observe what they do has been one of the things that I found most helpful as training, in a way, to how to also then lead as a PI myself.
So we've talked a lot about sort of positives and leadership and mentorship, and absolutely, Julia, people who inspire you. And I think careers and medical careers and beyond are all about that, aren't they? But Sachin's brought up, how do you deal with conflicts between PIs, co-PIs? Does anyone have experience of times when it's been more challenging?
Anyone who's run a trial has had experience of that, I'm sure. I mean, I think I would say Andy's already said one of the, I mean, you have to be there. Yeah, especially when it's getting difficult, that's when you have to meet people and you have to really find out what exactly it is that is going on, what exactly is the issue, because what you might be hearing at a distance, both within a site as well as a coordinating or chief investigator, may not actually fully reflect the issue. And so I think it goes back to also, I think Hilda said as well, the listening more than the actual doing in a way, but being there, observing, gathering information, getting everyone to really voice what their concerns are, and then trying to work with everyone together to find a solution, I would say.
Yeah, of course, being a good PI, you also take on roles of human resource manager. And these are the skills that help you build a cohesive team. But conflict, yes, sometimes arises, and you need to call these teams and talk to them, because that might actually affect your trial. Just people not wanting to talk to each other, because everybody is important in the process of the trial. And if any small thing goes wrong, that can affect your trial big time. So it is your role to make sure that if there are any conflicts, first of all, I think as Hilda said, you have to listen. Things may not necessarily come to you immediately, but you have to keep your ear on the ground. You have to listen, you have to know what is happening and address these issues quickly.
Perhaps I can add, like, so a lot of this is about communication, of course, as so much management is. I think some of it can come down to good chairing, for example, on a call, so making sure that voices get heard, because there will always be dominant voices and personalities differ. So in a multi-site trial where you have many PIs and maybe you're the CI, chief investigator of a trial, you may have to draw out those voices. That PI needs to represent their team. It may be they're representing their country, and things are very different in different parts of the world, and they need to make sure their voice gets heard. So as an example, I've been involved in a trial where the design of the trial didn't feel right for our setting in Zimbabwe and was being dominated by other voices. And actually, you've got to really speak up for your team to say, this isn't going to work in our setting for these reasons. And actually, otherwise you're doing a disservice to your team. So, there can be conflicts that arise between settings. I think, again, in-person meetings help. So I think any multi-country trial that can bring everyone together into one room always helps, because then you know who those voices are at the end of a Zoom call. You've got to know each other, you've built a bit of a relationship, and that helps resolve conflict. So I think all of those, communication really.
One of the other aspects that's challenging is around the finances, and Di's put a question in the box about how much, or panel views on transparency about finance management. So how much and what to say at the beginning of the trial, when to have meetings with whom along the way, and it's something you touched on, Andrew, in your talk, and obviously have a good handle on.
Yeah, I don't know the answer to the question, but it's really tricky, and ultimately a lot of your staffing is governed by budgets. I think if you talk to HR practitioners, 90% of people in the world feel they're not paid enough, and so you've always got a team you've got to manage who, don't necessarily feel rewarded for the amount of work they're doing. You've got to manage that kind of situation. I actually recently gave a presentation to our organization and explained how grants work. So I explained the difference between direct costs and indirect costs, because one of the paradoxes of an organization is you can be busy upscaling certain aspects of your, like you might have a vehicle that a donor has funded on a grant, for example, or a certain specific role in the organization. Meanwhile, in other parts of the organization, you're downscaling because some project is finishing or some certain role isn't covered by grants, it's covered by overheads. And that's really complicated. If you're on the ground as a team member to see this department building up and this other one not being prioritized, I think that needs communication. And I tried to explain how sometimes that happens because you have a win on a grant that allows you to employ 10 new nurses, And meanwhile, you can't keep your finance team going in the size that it has been. So I think a bit of transparency, I don't know whether it works, but I try to be honest about how these decisions are made.
Thoughts from any of the other panel members?
Yeah, I think transparency, for example, I'm the executive director and I'm also the PI. I have to know each and everything, every detail about the budget, and now we are going to keep afloat. Some of my principal investigators are doctors in the clinic, and with regards to how much detail you can share with them, of course, the person who is in charge of your budget is your finance person and senior finance person. Even when we are developing the budgets, I will be there looking at the budgets and see how it matches with what I have to do in a protocol. So that is important. After the budget is passed, the budget performance, you may not have to discuss in very detail with your principal investigator, but the principal investigator needs to know, these are the tasks I have to do. This is my budget performance. I'm overspending, therefore I may not be able to finish the trial. And of course, the PI would be working with the head of finance and with me, because at the end of the day, I have to know exactly what is happening with budgets and projects. So in terms of transparency, I don't know, there is nothing really to hide. We have a budget, we have work to do, and we have to do it within the budget. But we also find, as Andy said, we are overspending on some things because of circumstances, things that we didn't even anticipate. That's when we go back to the fund that die and say we need more money here. But I think the PI needs to have a handle on the performance and what needs to be done, because they can just keep asking, I want 2 more nurses, I want another doctor. And yet what they have is enough, they could do with that. And if they don't know what the budget and the limits are, then they can't plan with you properly.
Yeah. I just want to agree with Cissy. You know, when figures come, we get a grant and it's for $500,000. It sounds so much money. And if you are not clear to the members of your team, I think that transparency, especially with head of departments who run the study, is very, very important, because if all they know is that we have money to run the study and they don't know that their department is using so much money and this is how much money they have and this is the pace at which they're using money and why you are cutting down on this or cutting down on that, for them to be careful. I like Andy's idea of even making them understand what is the direct and indirect costs, because that makes them realize how you use the money. So I just think transparency, especially to the level of people who head the various departments, is very, very important. Thank you.
We'll probably run over a few minutes, and also just to remind everyone that we'll do our best to answer some of the questions that we don't get around to in the chat box, and that will all be available afterwards. But just to change tack a little bit, there's a number of questions on the same theme, which is how does someone in their early stages of their research career align themselves to becoming a successful PI, and what steps are key to take? And also the sort of question, is there a specific amount of experience that someone needs before joining a study as a PI? I wonder what anyone thinks about that.
I think we touched on this a bit. The education is necessary. Most sites, at least for Africa, I see it is medical doctors that become principal investigators, but nurses can become principal investigators. Anybody can become a principal investigator. What is your level of confidence? How much leadership do you have? Because you're going to work with a team and you are the leader for the team, so you have to have leadership skills. But I think where we all started was being an investigator in a trial. And then we are passionate about research. And career growth means I have to be a PI and I have to be a good PI. This is where the experiential aspect comes in. You need, I think, as Julia said, whom do I want to emulate? You can go and talk to them so that you work on them, you work with them one-on-one. I don't think any good PI is not willing to train another investigator to become the next good PI. I'll stop there.
Maybe I'll add a comment. I think 3 thoughts. Number one, I think that role I mentioned about being a sort of a lieutenant or whatever, you know, somebody who sort of implements a trial under somebody else's guidance is a really good way to learn. So I think, you know, you're not ultimately responsible, but you're learning all the steps and what it takes. So that's one approach. The second is, you know, co-PIs is an option. So if you're getting to the stage of being quite experienced, but you want somebody else to work with, you can be co-PIs, and it's often encouraged now to put in grants, you know, particularly if you're working in partnership, the UK and Sub-Saharan Africa, to have a PI from both places is great. The other thing that some of the funders now do is a role called a researcher co-investigator, where you can be named, you can be an early career researcher, you can be named on the grant. So again, you have a role and a named, you're not yet ready to be an investigator, a co-investigator, but you're one level down in the early career stages. And that will give you some recognition that you contributed to bringing in a grant, to running a project. So it's good for their own CV, and it's good learning. So I think it's mentorship really, and sort of learning under the wings of somebody else.
I'd agree, and those opportunities to learn. I mean, in the UK, we've recently formalised that as the associate PI scheme, where trainees, and some of you are UK based will probably be part of this. Trainees are encouraged to find a trial that they're interested in, and over a period of 6 months, get experience in terms of recruiting patients, completing all the necessary requirements, you know, learning about the study, actually joining and guesting, sitting in on TMGs and TSC meetings and things. And it's in its infancy, but hopefully that's a really good way of getting trainees experience, confidence, and really ready to be PIs themselves. And it's something that at CTU we've been doing a lot of work on, and it's probably a scheme that there are aspects of could be adopted elsewhere, and other people could take some of those resources, which I'm sure would be happy to share. We've probably got a few more minutes left. Someone mentions about sub-studies, and everyone loves sub-studies and adding sub-studies to trials. How do you manage those and manage the expectations as people try and incorporate those into your trials?
Yeah, I can maybe comment on that, because I think they're both a blessing and a curse. So in a good way, like, you want to maximize the learning from your study. And I think if you're doing randomized interventions in humans, it's the only experimental approach we have to really perturb a system and to kind of learn mechanistically if you're a lab person. So like, I love doing sub-studies within trials, but they bring their challenges, and it's really hard if you're managing a team who all have their pet sample. You know, they're interested in the microbiome, and that's the only part of the trial they really know about. And yet, you know, that may not be your biggest priority as the PI, getting every stool sample in perfect condition. And there's always a balance to be had. I think they can help with some of your funding challenges. If you bring in a sub-study, it's another way of maybe embedding another research person, a research nurse, or your lab team within it. So it can be really helpful. But ultimately, sometimes you got to say no. Like, sometimes people want to add another person, another protocol, another consent form. And at some point, you got to say enough's enough. It was my thing about focusing like a laser on the main purpose of the trial, which is getting your primary, secondary outcomes. So great, but I think with a balance is what I would say.
Yeah, with respect to this topic of today, being a good PI, I think sub-study, irrespective of what Andy has said, I think sub-studies are also an opportunity for the young investigators to get a handle of what to do. So it is a smaller thing. It's not the main study, but you give them responsibility to be the chief investigator for that sub-study. And that is then part of mentoring. So from a sub-study, it goes onto your CV with the respective publications, and then you are climbing higher to replace me so that I can retire.
Can I just add to that, Cissy? Because I think that that's also a really good way to engage if you're working with lots of sites and you're not running a study just in one place with a team that is, you know, already very settled with each other. It's also a really good way of engaging the PIs and then co-PIs of the sub-study at that site for the main trial. So sometimes actually people feeling like they are taking responsibility for a sub-study is a very good way of making sure that they're also engaged with the main trial. So, I mean, I totally would echo what Andy said. They're a blessing and a curse, but they can be quite a useful tool in terms of just making sure that everyone is engaged and everyone feels that they have something in the larger project that is their responsibility to look after.
Yeah. And I think it's like everyone has said, it allows bringing out of talent, because you've got somebody who has got a talent in PK studies, for example. We've got that example at our site. We've got a very good person, clinical pharmacologist, and she's good at PK, and her talent just comes out so clearly with this sub-study. And the same with the microbiology sub-study, it brings out talent in certain people. But if you manage to get funding for it, then that's excellent. But sometimes it stretches you as well. Thank you.
That's all about, isn't it? Like leadership, bringing out talent, bringing out people's own expertise and passion. There's a couple of comments, a couple of questions, though, that when things are a little bit more tricky, so just sort of finally in the last minute or two, a couple of questions. One's, how do you draw a line between being too involved with the different team members that you end up having to do the work for them and sort of supervising them so much, constantly making decisions for them? And also, how often do you need to check in terms of training for the team? And how do you make the time to look after the team when things can run so fast that you know that people aren't the priority? Don't know if anyone's got any insights or tips or thoughts.
Yeah, I think it's that balance thing that I was saying between not getting too far into the weeds, but sometimes you have to get dragged a little bit in there to resolve issues. I always sort of use the analogy of like a cardiac arrest in a hospital, where the team leader there is always the person who stands back and has their hands behind their back and is watching and keeping an overview and is trying not to be the one jumping up and down on somebody's chest, because actually if you do too much of that, you're not going to have an overview of everything. So I think it's that kind of balance. And then I think that the sort of it comes back to what many on this call have said about valuing your team. I mean, it's Hilda's point, knowing people's names, knowing their roles, knowing their families, that little bit of human interest. I mean, it's not unique to being a PI, but for any work relationships, it goes beyond the delegation log into kind of their lives potentially. And I think that helps all of us.
So, of course, all the team is trained at the beginning. It's trained by usually a CRO, by the funder. And sometimes you have to retrain, especially if there are mistakes. First of all, you let people, they need to be open. If a mistake has happened, it has happened. They need to own up. And sometimes as corrective measure, you have to retrain. For some of the staff, and this is where you identify talent and people's abilities. Some people are so good, you train them, they know what to do, they fly with the study. Some of the people in the study, you have to be able, you have to have to see who needs help, and you see how to help them, maybe on one-to-one basis or through maybe their head of department, because really, I think you need time for other tasks that are very important. But sometimes you have to dig in, like right now I'm doing in one of the studies where I'm PI, there are issues in the lab and I'm saying, no, I want the very detail of what has happened and why we don't have this and that. And it is necessary because at the end of the day, you are the PI. If things go wrong, you are the PI. If things go very well, you are still the successful PI.
I think that's really important, isn't it? And there's some of that's about the honesty of the situation and where you find yourself. And I think as Andrew alluded to, we often get into a trap of, it's easy to fall into a trap of wanting to help and wanting things to be right and wishing things were otherwise, but actually there is an honesty to it. And there's another question about how do you often you see people who are PIs for multiple different studies, and how do you do that? How do you keep your head around all of that? And again, I think it is the honesty, isn't it? How much time does it really take to be a PI? And I think as all the presentations and the discussion today shows, it takes time, it takes commitment, it takes real commitment to the study, but to the people and to the team that you're leading. But that's usually rewarding, and that's where it comes from. So it's we're sort of 10 minutes over, so I suspect we should probably just begin to wrap up. Any final thoughts, comments from any of the panel members?
So I would just like to go back to a point that Andy made that would have been my top tip. And I didn't get to show, but also, again, it was just a picture, so no matter. And that's really that I think one of the key things in being a good PI is actually running effective meetings. And it's also one of the things that I've observed done not very well more often than other aspects. So generally, working with other PIs or CIs, it's not a lack of enthusiasm or engagement or whatever that I've usually encountered, or dedication to a study. But it's curious, I think, that in research, this very specific item can really be something that can turn an okay project into an excellent project. So I would just like to pick up Andy's point around that, to say that I think if there's one thing that people want to focus on that you can do at all different levels of working in a research team, then I think thinking about how you can make meetings more effective and really address critical aspects is a really good thing to focus on.
Yeah.
So my tip is a summary of my presentation earlier: effective delegation. And it means many things. So it is really loaded, effective delegation, because a clinical trial is run by a team. And a good PI is not going to do everything in this clinical trial. So how effectively are you delegating work to others? But as we delegate, we need to build good PIs in our institutions. And building a good PI is not just your qualification. It is hands-on learning and training. So let's interact and make many good PIs out of the audience.
Okay. So thank you very much. My last tip is, I think it's always good to know that the work that we put on, the effort that you put is always rewarding. There is a reward at the end. Even if, people write papers, it comes back to you, it goes again, it comes back, you rewrite and write again, but eventually you get a reward from it. I think it's important to always remember that the work that you put in is rewarding. And I want to reiterate what Cissy just said. It's not about me, it's about us. It's us, not I. If you find yourself in the team always saying, I do this and I do that, you have a problem. It should always be, we do this, we should do this, because it's a teamwork. And the words should be we, not I. So I just think that it's a very good place to be a PI, but it's even a better place if you can be a good PI. Thank you.
I think my last comment is perhaps that this stuff is quite difficult and nobody teaches you it. There's so many different roles needed to be a PI. And I think most people really do learn it by doing it and being mentored by somebody who did it well or badly, and you learn how you want to do that. For example, no one ever taught me how to manage a budget. I mean, it's just something as a doctor you don't get taught. As a researcher, you kind of learn your ways, or I learned from people who I worked for how they manage budgets and kind of took the best bits of that. So I think it's not necessarily written down anywhere. It's experiential, like find good mentors. And, we gave you various ways that you can become a PI sort of through different schemes now. So, yeah.
Fantastic. And fantastic place to end. So thank you to all the panel. Certainly I've learned loads and feel inspired for the rest of my day in clinical trials. Thank you so much to all the participants. We had a fantastic turnout, really good questions, really engaged. And as I say, we'll do our best to answer the rest of the questions in text. Do rewatch the recording, and yeah, look forward to the next sessions. So thank you all and have a good day, everybody.
Thank you.
Thank you so much. Thanks, Duncan.